The Department of Health is warning parents with young children to remain cautious. Singing River Health System pediatric specialist Dr. Tamara Harper joins us now with more. Dr. Harper, thank you so much for joining us. And of course, it's always so difficult to hear about children who die from this disease. There aren't very many, but when we do hear about it, it's especially sad.
Definitely. And that's the message that we're trying to get out to our pediatric population and to our parents, is that everyone says that it's a mild disease in pediatric patients, but when it's that one, and when it's your patient or when it's your child, that's that one that dies from the disease, it's very, very, very sad.
Yes, it is. And I know that we have enough numbers on adults, of course, to see that most of those who end up with the serious cases and who are hospitalized are still the unvaccinated by majority. Are you seeing that among children as well? I know we don't have as much experience with the vaccines and kids.
We don't, but we have been vaccinating. You know, it's been mandated down to the age of 5. Since like November, down to the age of 12 since May. So we're coming up on about a year that we have had vaccines available for 12 and up, and for 5 through 11 since November. And again, even in those 13 cases that you'll see where those pediatric patients have passed away from the virus, I would say 99% of those were unvaccinated.
Okay, so that's important to keep in mind too, I know, and as you continue to encourage people to vaccinate their kids. And the delay in approval for kids under 5, does that pose a problem as far as you're concerned, do you think? Is that age group at high risk?
Yes, that age range, definitely the babies under 1. We saw lots of cases right after the Christmas holidays. And to be honest with you, I saw the most cases between Christmas and now that I've seen throughout the entire pandemic. And it's difficult, you know, to tell those parents when they present with a 3-week-old who's positive, that there's nothing that we can do to treat the disease process. We pray that, you know, they do well with symptomatic care, and the majority of them do. But again, when it's that one baby who has serious complications, secondary to the virus. And we also have to be mindful that in the pediatric population, there can be complications even after the fact of going through the acute phase of the virus.
And we're seeing the numbers go down, which is, of course, very encouraging. They dropped down to below 600 today, so that's the first time it's gone below 1,000 in a pretty long time, I think. Is that encouraging to you, but also concerning in any way that people may let their guard down? I think a lot of people already have.
A lot of people already have, and the state health department is predicting that we're going to have another spike in the next 6 to 8 weeks. So I would be mindful of that, and hopefully, you know, urging our parents and our populations not to let our guards down. You know, it's still important to wear your mask in indoor settings. It's still important to limit, you know, outings to small groups, and hopefully small groups where everyone is vaccinated. And again, in those populations where they're not eligible for vaccination, if everyone around them is vaccinated, that helps to protect those, you know, those vulnerable infants who are not in the age range to be vaccinated as of yet.
So true. All right, Dr. Harper from Singing River Health System, thank you so much for joining us today.
Thank you for having us.